The Ascension Parish Mental Health and Addictive Disorder Board is called to order. We have Miss Brenda is supposed to be late. She's caught in traffic, and Mr. Butler is supposed to be here later. So we will do the roll call at the end, Celeste, if they don't show up. Approval of the minutes. We have August the 16th of 2007 minutes to be approved.
I make a motion to approve the August 16, 2007 regular meeting minutes with any necessary corrections.
I approve.
Second. And I approve, so it passes. September the 27th.
Motion we accept the September 27, 2007 special meeting minutes with any necessary corrections.
I second.
And I vote to approve. October the 18th, 2007 was our needs assessment.
Motion to accept October 18, 2007 needs assessments minutes with any necessary corrections.
I second.
Okay. October the 24th, 2007 meeting.
Motion to accept October 24, 2007 regular meeting minutes with any necessary corrections.
I second.
Your pleasure. He said November the 15th.
Motion to accept November 15, 2007 regular meeting minutes with any necessary corrections.
I second.
Second. Okay. A 2/3 vote to put something on the agenda. I don't believe we have that. Public comments.
We have Mr. Brad Levine, who signed up to speak under personnel.
Mr. Brad Levine.
Good evening, board. How y'all doing tonight?
Hello, how are you?
I didn't really come here prepared to speak on too much. I just want to tell y'all much appreciation for y'all service to Ascension Parish. Apparently not many people see that. And the problems you've had with the present administration just plainly shows that the present administration cares nothing about public service whatsoever. I believe mental health is probably one of the most, and addictive disorders is one of the most biggest public service areas in Ascension Parish. It protects people, it protects our children, and it's just a crying shame that the parish government, the present administration and council, just throws it aside. A couple problems I have is these ordinances. In the ordinance that is on the parish website, I believe there was one other ordinance that was passed later on in the year of 2004. And then there was one prior to that. And my biggest concern, and I'm going to address the council with this evening, is I don't believe the council knows what ordinance to follow. And, it's a crying shame because they passed the ordinance that's supposed to be into effect with mental health. There's no problems. They redo ordinances for planning and zoning. They redo ordinances for wastewater, for Board of Adjustments and everything else, just like they do mental health. And there's no issues in any of those boards on what ordinance to follow. And I think it's a crying shame that we have elected officials that sit up here twice a month, and we have an elected official, the parish president, sits in his office every day, and they let this go on. I want to commend y'all for a job well done. We'll have a new administration come January the 7th, and hopefully the present administration will work with the ordinance, either changing it to suit the needs of Ascension Parish, which is basically what they need to do, instead of suiting the needs of the administration. And but I just wanted to thank y'all. Y'all done a wonderful job, and just keep up the good work and everything.
Thank you.
Thank you.
Thank you.
Mr. Ron with the state report. Good afternoon.
Good evening.
Hello. How are you?
I passed out the The statistics, if you have any questions on those, they should be in your packet. Excuse me.
We can't find it.
Okay, I
It's right
have
after
some.
the agenda.
Huh?
It's right after the agenda.
Oh, okay. I thought I went through that. Sorry.
That's okay. I have some copies if you need some.
Yes, sir. It is here.
Okay, good.
Thank you.
Thank you.
Sure.
Go on, look at that.
Okay, if there aren't any questions, I just have a few things that I want to discuss. First of all, Capital Area Human Services District has an opening for a registered nurse program coordinator. This person would be responsible for quality assurance for nursing throughout the district, and so anyone who's interested can call the Capital Area HR department. It is a position that was recently vacant, and so we're currently looking for basically the nurse supervisor. And the other thing that I want to discuss is there's an opening on the Capital Area Human Services District Mental Health Advisory Board. So this is a board that I think meets quarterly, looking at what goes on for treatment services for Capital Area across the district. We have representation from all of the parishes, including community involvement with community leaders. And so anybody who's interested could call me at the office, Gonzales Mental Health Center office, and I will get you in touch with the people that you need to get in touch with. So that's all I have tonight.
Thank you.
Thank you.
Happy holidays.
Same to you.
Happy holiday to you.
Miss Susan with the parish. Dr. Susan.
Thank you.
Yes,
I
ma'am.
have a very brief report tonight. On our statistics, I'd like to point out that we received 1,140 appointments. Were scheduled. 899 of these were kept. This is an increase over November of last year of 229 scheduled appointments and 241 appointments kept. We also screened 138 calls, and our Donaldsonville services, we were there 46 clinical hours and provided 22 hours of service. Under our collections, in November of this year, we collected $8,123, as opposed to November 2006, $6,919, and November 2005, $9,468. Under personnel, we have replaced the receptionist who resigned. The temp secretary that we had has accepted a full-time job as of December 10th, so we're fully staffed.
Well, Susan, right there, you violated the ordinance because you were supposed to come to the mental health board before you hire anybody.
Only professional staff, the ordinance says.
No, ma'am. It says all employees. Thank you.
Under the same topic, personnel, we've accepted a counseling student who's in the professional counseling program at LSU. She's going to begin working with us in January. She will be a student intern at the master's level, and she'll be working with our mental health counselors and our substance abuse counselors, both at the Gonzales Clinic and the Donaldsonville Clinic. So she'll split her time between the two locations. And she'll work 40 hours a week throughout the semester from January to May. And there's no charge to us for her services. In the fall, we plan to accept a social work, at least one, possibly two social work interns, depending on where we have the space to put them. So we're pleased about that.
Excuse me.
Just a minute, please. They'll be supervised by our existing staff. Our LPC, one of our LPCs, licensed LPCs, will supervise the counseling intern, and one of our licensed social workers will supervise the School of Social Work intern. Yes, Mr. Butler?
You just answered the question I needed to ask you. Who was over these entrepreneurship students? That's why I asked. Okay. I just wanted to know if somebody was certified to do that.
I have no report under financial. Under grants, very little to report. Our new $40,000 prevention grant that we received from Capital Area, the one in addition to the one we had received in July, will go into effect on the 1st of January, and it will expire the 30th of June. And we've already started working on some of those programs, started providing those services. And nothing to report under the Capital Area Treatment Grant. Under the hospital funds proposal, I went and made the proposal to the hospital board at their meeting in November, as we discussed at the previous meeting. They have not given us any response. This is the proposal for crisis services.
Okay, under that, Ms. Renda wanted to talk. She had made some proposals to include some of her ideas. They were not put in the proposal.
Well, she recommended that we expand the hours of the clinic, and we already open 12 hours a day, so I really, that's something that's going to take a great deal of thought and planning. That wasn't something we could just stick in a proposal.
Well, she recommended several other things, so she says, but she's not here
Okay,
to
well, I'll be
talk on
glad
it,
to
so
talk to
we'll
her, sure.
have to talk with her.
And
Okay.
it's my impression that if the hospital board does fund our project, they'll be flexible about refining it further. So
Great.
I don't have the sense that, you know, it
That it's in
can't
stone?
be changed yet.
Thank you.
Under programs, we're...
Excuse me.
Yes.
Under grants, have we made any attempt for the needs assessments as far as funding it?
Yes, that's just what I just finished saying.
Okay.
Under programs, we're continuing to refine the crisis intervention program. As I said, we're waiting for a funding decision. And under facility projects, we had to repair air conditioning units in both Donaldsonville and Gonzales, and we have some roof leaks from the last big rain in Donaldsonville, and those...
Who's controlling the air conditioning units? I don't understand this. Every month we repairing the air condition.
I think we have 10 of them, don't we?
No, I'm saying,
Different ones go out different times.
who control them? Is there a set or something? Look like every month air conditioning going out. I don't
That's true.
understand.
10 of them.
Yeah.
And each one has heat and air conditioning, so you might repair heat on one, air conditioning on another. So we just take them as-
Especially the ones in Donaldsonville. That's not a big place. And man, it look like every month they're repairing the air conditioner there. Correct me if I'm wrong.
It does seem.
I'm trying to figure out who operating them.
That's all I have under my report. Do you have any questions?
Question under grants, item B, states some of the grant-funded services have already begun.
Yes.
What are some of the services?
We're providing a substance abuse prevention group at the alternative school in the options program, and at Donaldsonville High School for middle school students. And that one hasn't started yet, but the options program has already started.
Thank you.
Under facility projects, repair of roof leaks in the Donaldsonville clinic accepted. I don't remember this.
I'm sorry, accepted as a mistake. That's a...
Well,
That's
I
a
just want to
mistake.
make sure that's clear because last time,
You can discuss that with Mrs. Koki.
well, I mean, you're the director though.
Mrs. Coker
Is in your report, okay?
Mrs. Koki handled the project,
I
so she can
understand that.
advise you about it.
Okay, well, Ms. Kogi should have had her stated this. You stated this. You're the director. She can't do it without your approval. And for to pay somebody what it was, $1,200 to walk around on the top of a roof to tell you if it's leaking or not, and still haven't repaired it or patched it, I don't know. What else could we do?
We have to prepare, and we have to fix the roof if it's
I
leaking.
know you have to fix it, but I mean,
Yeah, I don't
we
know.
throwing away money. I mean, it's taxpayers' dollars we talking about here.
Jerry?
You know, I mean, we spent $1,200 for somebody to get on top of that roof and walk around just to see if we had a leak on a rainy day,
I understand.
and it's not repaired. I don't understand. I mean, this my money. This everybody's money that live in this parish, and it's being misused. I mean, I'm sorry. I mean, that's just my opinion. somebody needs to do something and do something very, very fast before we go bankrupt.
Thank you. Does anyone else have any questions? Thank you, Dan.
Next on the agenda is to approve the DA's invoice.
Motion to approve the DA's invoice.
I'll second.
Brian? Okay.
Miss Coke, excuse me. I'm sorry to go back.
Yes, sir.
On the roof, could you explain it to me, please, since
What happened was,
the director couldn't?
actually, when there was some questions a while back about whether there was a roof leak or not, we did, we sent in a request to maintenance, and they had somebody come out and check, and they charged us that $1,200. At that time, they said there was no leaks in the roof.
But we did, as a board, approve that to happen, right? To get it checked.
Right,
I remember
y'all had
that.
asked. Okay, exactly. Well, it was reported to us again, one of the task employees, that the room was very smelly. They did see water coming down by off the wall, and we had maintenance go out again, and they sent out a company, and it was actually a roof leak this time, and they're retarring it and putting gravel, and I think the amount is $2,100, if I remember right. And I called Miss Italia, and we spoke about it, and I mean, the roof needs to be repaired. There's water coming down on the walls, so we went ahead and did go through with it.
Okay. I just wanted some type of explanation, because I know we had someone to go up there and survey it.
And
But
at that time, they did in the report tell us that there was no leaks. So I don't know if it happened from that time till now, but the task employees
it
did
hasn't
report.
been that long. You see what I'm saying?
But I remember.
That ain't been a year. That haven't been
No,
a
it
year yet.
hadn't.
No, but it had to be a leak that just developed, I would think. I mean, because we've had many rains. And if it had to be fixed, I mean, it's just something that had to be
Yeah,
done.
it had to be done, but I just wanted an explanation on it, because I didn't want us to pay for nothing that had already been surveyed and done. If they're responsible,
Right.
we should be covered under some type of warranty or whatever the cause may be. Of course, I'm glad they're fixing them
It's
to
actually
repair
the
it
same
before
company who came out and did the survey for us. They're the company, I think, who was awarded, if I'm not mistaken, to go out and do the work now.
Okay. We need to take care of that. In order to get the inside done, you got to do the outside first. So,
Exactly.
thank you.
Okay.
The budget, Ms. Celeste.
Now, I've included into your packets the November 2007 budget report. You only have the revenue and expenditure this month. You don't have the account activity or the open encumbrance. They wasn't ready today. So as soon as I do receive them, I'll forward it to you by email, and then Ms. Z and Ms. Italia, I'll put it in the mail for y'all.
Okay.
And if y'all have any questions, like always, just go ahead and give me a call. And that's it.
Okay, I see we are overspent in professional services.
It's actually, it's encumbered. Encumbered means that that's what the contract amount was. But when we come to the end of the year, it's not going to be over what we actually spent.
Okay.
Also, we had budgeted for 50% of Dr. Bourne's to come out of mental health and 50% to come out of substance abuse, and all of it was coming out of substance abuse, so they're going to do a journal entry to put that back in mental health also, so it's not going to be as uneven.
Okay.
Any other questions?
What is the GSFD grants?
That's Governor Safe and Drug Free.
Okay, how come we over?
The way that works is we estimate how much funds we'll use from January through December, but the grant runs on the state fiscal year.
Correct.
So it's really hard for us to see how much monies we're going to use. So when we do the amended budget, we do amend those amounts.
Yes, ma'am.
But it's not actually that we're over what the grant is. It's
For what the grant is?
right.
Gotcha. Okay. Anybody any questions on the budget? Time for me to go over it. We're staying within our budget, so I guess.
I think it was at 85%, if I'm not mistaken, if you look on the last page, as of November. So, yes, we are within budget.
Yes, ma'am. Okay. Under old business. In May the 12th of 2007, we made a motion to let the mental health director go. The parish president has not responded to that. And by the ordinance, if he does not respond to it, we are to go in front of the council for them to vote by the ordinance. I thought that was on the agenda for tonight, but I have been told that it is not on the agenda, ladies and gentlemen. I apologize.
Blocking it open.
I tried to get it on there, it didn't work. Anybody else with any old business? New business? Entertain a motion to adjourn.
Motion we adjourn.
Second.
This meeting is now adjourned.